My name is Dr. Amy Dayries. You're listening to the Whole Healing Radio Show, and tonight's guest is Dr. Angie Tenholder. Dr. Tenholder is a dentist in the St. Louis area. She's actually just over the state line, and into Illinois. But she has been doing the A.L.F. Appliance for almost 10 years in her dental practice. She is board certified in craniofacial dental sleep medicine and has also achieved fellowship status in the American Academy of Craniofacial Pain. Dr. Tenholder's passion is to utilize her learning and training and experience for over 25 years of dentistry to help both patients and providers understand the many benefits of A.L.F., which is an abbreviation for A.L.F., acute light wire force therapy. She is the wife of a 20-year-old veteran from the United States Air Force, a mom of 3 kids, and has a full-time dental practice in St. Louis, Missouri metropolitan area. She currently serves on 2 boards, the board of American Academy of Craniofacial Dental Sleep Medicine and also the board of A.L.F. Interface Academy. A.L.F. therapy is a simple yet sophisticated approach to health care with the goal of optimizing function of the oral environment by honoring the principles of nature. The petite yet powerful A.L.F. dental device was created over 35 years ago by Dr. Derek Nordstrom. He's in California, and it has become world-renowned for creating opportunities for health and healing that other dental appliances have been unable to duplicate. Dr. Angie Tenholder, who is our guest tonight, and Dr. Nordstrom have created the not-for-profit corporation A.L.F. Interface Academy, Inc., with the mission of introducing A.L.F. therapy as a nature-based and scientifically supported method of addressing the complex and unmet needs of patients of all ages. Let me start by saying that we can pan in on the A.L.F. device, perhaps. I'm going to show it to you out here, and it's a very, very small device. This particular one is for trauma, potentially, and it's an upper device. And it really can look a lot like an unwoven paper clip, in a sense. It's very, very lightweight. So here's almost our paper clip, so to speak. Wow. And it's a device that can be made for both kids and for adults. We're getting Dr. Angie back on here in just a minute. But in a nutshell, it can help grow a developing skull or support an adult or a child who has experienced some sort of trauma. And in a child that's developing, it can actually grow the face in sort of an outward, downward method, sort of like this kid's toy can.
Well, thanks, first of all, for having me. It's great to be here. There's a lot more people that need to hear about A.L.F. therapy because it is such a great adjunct to healing and health for all patients and all ages. The reason why the A.L.F. works is because it works with laws of nature and principles that existed long before dentistry did, long before we knew what exactly it was that orthodontics was. And those principles are based on 3 pillars. One is cranial osteopathy, as you mentioned, with the bones of the head moving, because it used to be we thought that after the age of 25, the bones of the head did not move. And we absolutely have research and a whole field of training called osteopathic medicine that honors that movement because we are living beings. So the movement of those bones is influenced heavily by the teeth. Mm-hmm. So we want to have dental appliances that create and maintain motion in the bones of the head, and that enhances neurologic function. So that's one of the secrets, the mysteries of A.L.F., mm-hmm. because it's really the only dental appliance that we know of that has that leverage over the cranial bone system. So a lot of people think that A.L.F. dentists are, we think outside of the box, when technically we're thinking inside of the box of the cranial vault. Now, the other thing that moves those bones in the absence of an A.L.F. in a perfect world is the tongue. The tongue is what is supposed to guide facial growth. So as the tongue is elevating to the roof of the mouth, it is moving those cranial bones, pumping the cerebral spinal fluid, and honoring nature's resilient force in building these bones of the face, as you showed with your little face toy, expanding outward and downward.
This little toy. There is a name. I just don't recall what it is. Okay.
And so the teeth, which we obviously want to be pretty and white, and in dentistry, we're taught to line them up and get them in function, but we don't really know much about how to integrate the teeth with the body, even though we are doctors of medical dentistry or doctors of dental surgery based on where we went to school. Systems medicine has kind of segregated us and put us in a corner. And I love what you're doing with this show because you're highlighting the fact that the teeth are very connected to the rest of the body. Millions of research studies have been done. Well, maybe not millions, but a lot
Lots.
of research has been done to show the connection between the two.
For decades.
When you Yeah. When you become an A.L.F provider, you become acutely aware of those things because things just happen to get better and you don't always know why, but they do. Because when you honor those laws and principles of nature, the body will respond favorably.
Very cool. How did you get involved as an A.L.F provider? I obviously you have some extra schooling after dental school, but there must have been a draw for you with that.
I didn't choose this, it chose me. I became a chronic pain patient at the age of 35. So I was seeking physical therapy for my temporomandibular joint problems. I had chronic pain, migraines, headaches, and the physical therapist that I was going to first made me get a dental orthotic, which is the most controversial thing in dentistry, where to put the jaw joint, what kind of appliance, how to position it, how to treat it. So I got the training for that, but I didn't get completely better. So she said, okay, now you need an A.L.F. And I'm like, oh, for God's sakes, what is an A.L.F? Isn't that some kind of cartoon character on TV? So researched it and I got an A.L.F. And within about 2 weeks to a month, my symptoms of chronic pain resolved. I was able to go off 2 antidepressants and a lot of things in my body just came back online that had been slowly going offline for a very long time. So once you see something like that, you can't unsee it.
That's awesome.
So then I started treating myself and started realizing that there's other patients that could use that help, including and especially my children. My middle child had Tourette's, and when we put the appliance in and just changed his bite just a little bit, his Tourette's went away. His athletic performance improved. He was able to do a lot of things he wasn't able to do before, and he was completely free of his tics. Now, it was management. It's not just the dental appliance. There was some nutrition and some other things that went along with it.
Certainly.
But as long as he wears the appliance, he was able to control his condition that was debilitating him as a 5th grader. So he was getting depressed and gaining weight. And once we got his treatment started, he really blossomed. And we see that a lot with patients, not just with low functioning conditions, Tourette's or Down syndrome or autism spectrum disorder. We see that with everyone because it just improves their quality of life across the board, whether it's pain or function or cognitive ability or just peace of mind. A lot of people just feel more comfortable when it's in their mouth, which is weird because most people think a dental appliance that would be uncomfortable. But I have a lot of patients who, while I'm adjusting it or talking to them, like, can you please put that back in? Because I just feel better with it.
That's
true. Pretty amazing little wire.
It is amazing. And to me, I often liken it when I'm explaining it to patients that it's sort of like an unwound paper clip. But there are actually about 50 or so different designs of the A.L.F. So there's also many, many applications and things you can do with it, with all of that.
Absolutely. And that's one of the biggest misconceptions about A.L.F therapy is a lot of people think it's one appliance design or there's one use for it, when there's really a lot of different completely customizable designs that can be used from infancy with the neonatal A.L.F to the adult sleep disorder chronic pain patient, because my husband has sleep apnea and Dr. Nordstrom actually was the person who originally developed the dorsal appliance for treating sleep disordered breathing. And it's been modified over the years by certain companies who thought it was a great idea. And since he was more into the idealism and not patenting it as a money-making machine, he didn't do that. But his principles are what go forward. And that's what A.L.F therapy is based on. And that's what we train our A.L.F providers to honor. Because it's not dogma. It's not one certain appliance that is a one-size-fits-all or this is what we do for everyone. It is completely based on what that patient needs at that time in their life. And the provider is trained to understand what those principles are and apply it to that patient care.
As when I first came to my first A.L.F class with you all, the A.L.F Interface Academy, one of the things that struck me, I did an integrative medicine fellowship. It was a 2-year program with the Academy of Integrative Health and Medicine. And we're always talking about having this respect or generating respect for other health care practitioners who might do something completely different from you, because there might be a patient that really suits. And when I walked into my first A.L.F class, I felt like there was an echo of that was my tribe of people. You all are looking at the whole body, and a lot of times there's sort of a team approach with the A.L.F because maybe that patient especially if they have had trauma, they might be seeing like a chiropractor or a craniosacral therapist, an osteopath, maybe a massage therapist. There might be some other things, so I want to delve into that in our program tonight about who those people might be and why, and when do they get involved, and is that okay? And generally, of course, it's really helpful and almost essential to have sort of a team approach, because there's a lot of factors that this can affect that we're also trying to appreciate. So having several sets of eyes on the same patient can really be informative, and so everybody's on the same page. So we get much better healing of a patient.
Absolutely. And what I was talking about earlier with the 3 pillars, which are dentistry, obviously it's a dental appliance, and we're utilizing the teeth as leverage to be able to get access to these other things. But the oromyologists, the speech language pathologists, the trainers of the tongue are integral in our team approach, because the A.L.F is a reflection or an amplification of what the tongue does. So we need those people on our team to get that tongue trained, like the personal trainers of the tongue, to get those muscles active and moving in the right direction. And then the other one are the cranial osteopaths, which are the ones that are specifically trained to understand those motions of the bones of the head. Not that other people can't influence them, but that particular specialty of osteopathy is how the A.L.F appliance was developed. Because as Dr. Derek Nordstrom started working with different dental appliances, he was working with osteopaths who are very skilled and very gifted at understanding the different effects of the appliances on the head, because that's their area of expertise. And so they guided him, as they said, this is what works, this is what doesn't feel so good. And so the 80% rule of what works on 80% of the patients, 80% of the time, he's refined it and is constantly refining it for our benefit, because he works with some very, very talented osteopaths that basically criticize everything he does. And so he takes it to heart. He goes back to his lab, he makes the modifications, and constantly is updating this for us. So when we have the team treatment, we also work with physical therapists, chiropractors, nutritional counselors, naturopaths, energy workers, all kinds of different people. Because I don't know if you've ever seen that Abbott and Costello routine of who's on first and what's on second, and I don't know who's on third. Sometimes we don't know where to start with treatment because there's multiple people that need to be involved in this patient care. But what we always emphasize when we're working with an interdisciplinary team is communication and to collaborate and not contaminate another doctor's treatment plan.
How it ramps up the sympathetic nervous system sometimes, or how that could happen.
Basically, you know, as dentists, we're taught to look at the little white things, and the tongue is that thing that's just in the middle of our working zone, and how sometimes we get it numb and it seems like it gets 5 times bigger and 10 times stronger. But really what I found out through my journey is the function of the tongue is key to health. So when the tongue is in the position of having to guard an airway, you're always going to be afraid of choking because your airway is blocked off. So that does get people really, really, really nervous, especially people who do have inflamed airway, from whether it's reflux, asthma, obstructive sleep apnea, just swelling of the airway in general, because we have a lot of allergens in our world today that we're dealing with environmentally as well, whether it's a food sensitivity, gluten, or
chemicals.
Absolutely. And that inflammation will cause what we can see to swell, which is fingers and, ankles, or cankles, as we call them sometimes. But it will cause us to swell on the inside, which is our airway. So then we get basically resisted airways. And getting that tongue to function more forward in the mouth is one of the things the A.L.F does, because the A.L.F is a constant reminder of where your tongue should be. It's a petite little wire that acts almost like an underwire in a bra, and it goes inside the upper teeth, right along the gum line, just as nature kind of intended for your tongue to be all the time, and reminds your tongue to stay there. And the little place behind your upper front teeth where you tend to burn yourself with pizza, when you can't wait for the pizza to cool down, that's where your tongue is supposed to be all the time. But a lot of people don't know that.
So you're saying
the A.L.F is a reminder of that.
You're saying that the tongue should basically, in a sense, almost be plastered against the roof of the mouth, starting at that spot, that little bump that's behind your 2 front teeth, on the gum, and further back. Starting
that should be the resting point for it. And basically, the tongue is supposed to be pumping the cerebral spinal fluid through the brain by pushing on the roof of the mouth, what's called the cruciate suture. And that movement of the bones of the roof of the mouth to the sphenoid bone, which are the bones of the inside of the head that 90% of our cranial nerves go through, keeps our body fluid and moving and dynamic. When we don't have that motion of the swallow, we do tend to have more neurologic deficits and problems and headaches and things like that. So motion is super important. And if you look at our planet, everything's moving all the time.
Mm-hmm.
So one of these laws of nature is the tongue is supposed to be moving rhythmically in a proper position for ideal function and facial growth. So when the body feels good, the parasympathetic and the sympathetic nervous systems are going to be balanced. So the rest and digest and the fight, flight, and freeze will have a balance. When they're out of balance, people tend to get more stuck in the fight or flight, especially if they have an inflamed airway.
That makes sense. When I have mentioned sometimes with my own patients cerebrospinal fluid, and I feel like their eyes start to kind of glaze over. Can you elaborate a little bit, but make it where it's hopefully just really easy for people out there to understand this connection between what the people are, I can see I've confused them. They're thinking the tongue. How does the tongue have anything to do with cerebrospinal fluid?
Well, a lot of people only think of cerebral spinal fluid as something that is tested with like meningitis. But what cerebral spinal fluid is, if you can imagine the fluid in the mouth, how if your mouth gets dry, saliva, you wake up if you've been mouth breathing at night and it doesn't feel good. It feels cracky and hurts. If you do not have cerebral spinal fluid going through the brain and all the way down the spinal cord to the sacrum and back up, which is a craniosacral model of health, you don't have that fluid motion. And that cerebral spinal fluid is what the osteopaths will call the potency of life. It is really electrically charged, very beneficial fluid. And we know what happens when you get stagnant fluid anywhere in a lake, in a stream, or a river, in your backyard. Things don't move as well.
Because you don't have a potential, basically.
Right.
Okay.
You need motion. And anything that impairs that motion, regretfully, a lot of dental appliances do impair that motion. And a lot of dental appliances do prevent the motion of the roof of the mouth and the two bones and to separate the roof of the mouth. Anything that resists that ability for the body to move can cause neurologic deficits. And that's what the research is proving with the microglial cells, which are lymphatic drainage of the brain. So that motion is what the A.L.F propagates and supports by enhancing the ability of the tongue to do what the tongue could have done. So it's kind of like a surrogate or a biomimetic tongue. For those who don't have optimal tongue function for whatever reason, because a lot of us don't, including myself, until November of last year when I had some laser work done, a non-surgical laser release of my tongue, which was fantastic. It changed my life. They don't have that ability to do it on their own, so they have to find different ways to do it. Some people clench their teeth, some people bite their nails, some people suck their thumb. They will create motion when they don't have it on their own through the normal natural swallow, the mature swallow. The A.L.F therapy process is all around creating a mature swallow for that patient, so they don't need the A.L.F anymore.
So a mature swallow, I think for me it does, but I'm just going to reiterate it because it may be completely new information for somebody listening out there. When you swallow, your tongue should be actually at rest. Your tongue should be really almost plastered against the roof of your mouth, all the way from front to back, everywhere. And it should be behind the teeth. And when you swallow, it shouldn't come forward and touch the teeth. You should be able to actually even like swallow while you're smiling. If you're able to swallow with a more mature sort of swallow. And there's a lot, when we say mature swallow, there's a lot of other factors that you could potentially measure. And that's what the study of oromyology or myofunctional therapy might be looking at. But when you might have had something happen to you, you may never have learned to swallow properly. When we have this mature swallow and the tongue is up against the roof of the mouth, the tongue helps to mold the palate, and it influences how the teeth can develop or come in to place. And it also is a soothing response to the body, and emotionally it can be a soothing response. And the reason, my understanding of is the reason for that, and correct me if I'm misinterpreting this a little bit, but the tongue is the second muscle to develop after the heart in utero. And so the 10th cranial nerve, also known as the vagus nerve, that helps pump the heart and tells you to breathe and gives you hiccups or makes you feel nauseous, also controls part of the tongue. And they're very closely connected. with a very, very basic life force, like you're talking about with the cerebral spinal fluid. So having the so-called mature swallow where the tongue is acting in its most natural position, it calms everything down in the body.
Well, it's just like if you look at the power in your house, your breaker box. As long as that breaker box, that all the switches are on and everything's good, everything's going to feel good in your house. But if you lose power, if you don't have full function of that box, the house isn't going to be working as well. So your brain works on the cranial nerve system, and the A.L.F really does support a lot of those cranial nerve functions. I'm not going to say that it directly or indirectly or get into the debate about that,
Okay.
because it is so supportive of that whole system.
Mm-hmm.
It really does augment the overall feeling of well-being. And that's over a decade of treating patients. That's what I see every day. Patients are just like, I can't explain it. I just feel better. I feel better. Do I have to be without it? Can I just keep it forever? And I'm like, yes, it's always going to be there. So if you can imagine a baby with a binky,
Mm-hmm.
how it makes them feel better, that's what they're doing. They're moving the cerebral spinal fluid. Regretfully, the binky is getting in the way of where the tongue should be, which is why we don't want it to be in a baby's life beyond 6 months of age,
Okay.
because we want that tongue to be there and not the binky. But that is what they're doing. Whether they're biting on a blanket or they're sucking their thumbs, they're moving their cerebral spinal fluid. So that wellness factor is what the A.L.F does for an adult.
It's really beautiful. At least I think so. So interesting.
I think so. And what I love about it is, you can't unsee something like that. And when every day you come to work and you see the differences that you're making in people's lives, not just about doing a filling or doing their checkup, but when they say, thank you for giving me my quality of life back. I'm sleeping better. I'm feeling better. I'm losing weight. And it's the parents with the kids that I think are some of the most powerful,
Mm-hmm.
because they'll know when their child is ready for an adjustment, when they're going through their growth phase, and they'll be like, she's due. She needs a little bump, because it's kind of like putting air in a tire. It just pumps them up. And as children are growing, they continue to need that support, which is why A.L.F therapists are trained to be able to know when it is that an adjustment is needed and helpful, and be able to guide that patient through and find their own health. Because that's one of the principles of osteopathy,
Mm-hmm.
is that we look for the health. We don't treat the disease. There's just a few little letters between illness and wellness, and we're all about supporting the wellness.
Very good. In our next section, I want to talk of our program. I'd like to talk about what kind of patient might benefit. What else can the A.L.F maybe do? For instance, can you use it to straighten teeth? I get that question a lot. I'm going to just kind of run down a lot of the questions that I get asked in my practice about the A.L.F on a daily basis, just for clarification for people out there of what all that it can potentially offer if they choose it for their treatment. Dr. Angie, you've spoken to various airway summits, and I just really appreciate you being on tonight. I do have a couple of announcements before we get right back into our program. I wanted to suggest that people out there tune in tomorrow for the Good Intention show at 11 o'clock a.m. when host Tim Ray will interview Professor of Psychology and Director at the Twin Studies Center in California, Dr. Nancy Segal. And also save our date, July 20th. We'll be here in Atlanta, or actually the Roswell area, at the Gate City Brewing Company for our Awaken Atlanta celebration party. Join us for fun and a good time. Go on UI Media Celebration Party on Facebook and respond. If anyone out there would like to call in and ask a question about A.L.F therapy, oral appliance, A.L.F oral appliance therapy, please give us a call at 678-495-4345. Again, that's 678-495-4345. Or you can also text on our Facebook if you're watching this live on Facebook. Dr. Angie, thank you again for coming on our program. I wanted to talk about who might be a candidate, so maybe they could seek an A.L.F provider out there, and maybe we can go over just some of the most common questions I get asked in our office, and I'm sure you have a number of the same ones or probably better questions. So tell us who might be looking for an A.L.F provider.
There's a lot of different providers doing a lot of different things for people. So first of all, we have a directory that's available to find providers in your area, and you can look at their training to see what it is that their interest is. Because an A.L.F provider is kind of like, it's no coincidence the guy that developed this, his last name is Nordstrom, kind of like the Nordstrom store. We're not on every corner like Walgreens. We're a little bit hard to find because this is not an easy path to choose. But when you find a provider that suits your needs, and some patients are just going to want it for their children. Other patients, like myself as an adult chronic pain patient, need it as an adult. So the neonatal A.L.F can be used as early as, a month of life when we know that a baby needs some support, even if they don't have teeth. And my oldest patient that I've used for A.L.F therapy is in their mid-80s because the motion of their head was getting a little bit restricted and they were developing headaches. They heard about what the A.L.F can do, and it worked. And she was like, thanks, I feel great. She now uses it only if she needs it now that she's feeling much better. So it can be used for anything from straightening teeth, because it is a dental appliance, to trauma release if someone has had trauma to their head and neck and the bones of their head get a little bit congested, if you want to call it that. The motion is restricted. The A.L.F can help with that. Or it can be used to support neurologic function, like in the child, or the case of my child that had Tourette's, or other patients with movement disorders, tardive dyskinesia, things like that. So it basically can be used. It's like, I call it the Swiss Army knife of dentistry. It can be used for a lot of different things, and it depends on the training and comfort level of the provider that you choose with, if they're going to meet your needs as a patient or not.
Very good. Do you want to talk about how it might relate to other systemic health issues a little bit more? I mean, or what you've personally seen. It doesn't mean it would be that way for everyone, or you'd rather just keep it. I know we want to keep it general tonight. Have you seen any? Have you treated anyone, for instance, with or maybe you don't want to go there, and I don't want to make you uncomfortable in any way at all. Have you had anyone with asthma, or struggling in school, or focus issues, or I've had people like that myself, and we were not treating those things, but they seemed to just be better. They had less troubles with that, like allergies, for example, seasonal allergies.
That's true. I think the answer is all of the above. It's never our intent, because we have to be very, very careful as dentists to stay within our scope of practice.
Absolutely.
And we're not promising to treat something that is not within our scope of practice. But if we happen to treat the teeth and understand its influence on the rest of the body, and other things happen to get better, then we're very, very pleased to support that. One of the reasons that the A.L.F works so well is because of its influence on the neurologic system in the head, like I said, thinking inside of the box, and the sphenoid bone. Because the sphenoid bone is a butterfly-shaped bone that attaches, and you can show that bone if you
I'm going
like.
to show her a little funny skull, all these colors. It's the pink bone. It's the pink, I don't know what color you would call that. Sort of a...
If you look right underneath
the
blue frontal bones, there is a triangle-shaped bone in the center of the head. And it's really three-dimensional. What you're seeing, if you can look at it, is almost like the top part of the bone. But what it really looks like three-dimensionally is a butterfly. So the top part of the wings of the butterfly attached to the skull in the temple area, and the bottom part of the wings of the butterfly attached to the muscles that go to your jaw joint and to your jaw itself. So when this butterfly-shaped bone has a lot of force on it through clenching and grinding in the muscles of the head, imagine the butterfly's wings not being able to expand and flow and flap. In the middle of that, if you can imagine the head of the butterfly, that's where the pituitary gland sits. And the pituitary gland is the master hormonal system of the body, with 90% of the cranial nerves going through this paper-thin bone. If there is constriction in that bone, we're going to have neurologic deficits. The technical term is called entrapment neuropathy. So what we do by supporting the function of the sphenoid, reducing the tension on that system, the nerves that might have been compressed and or the vasculature, the blood supply to these areas that might have been impaired, it improves. So a lot of things improve. And it happened with me personally, it happens with my patients. One of the things that we see a lot is sleep and attention. Because one of the things that the swallow does, a proper swallow, which remember the A.L.F helps train to a proper swallow. It's the only dental appliance that I know of that really can do that. The swallow is our recovery process. When we're, when you hear someone very stressed out, they go into the fetal position and suck their thumb.
Mm-hmm.
One of the reasons is we're moving that cerebral spinal fluid. We're mobilizing this area of the head, and we're becoming resilient through the swallow. So if you think about a baby being born, whoever designed the birth canal obviously didn't go through it. It's very traumatic. So what the baby does to be able to overcome that trauma is nursing and sucking. The suck, swallow, breathe reflex is something that we've got given as a gift at 38 weeks, and it's what sustains us through life. But a lot of people kind of don't do very well at the swallow and breathing part of the suck, swallow, breathe reflex. So the swallow and a normal functional swallow is how we recover. It produces delta wavelengths, and that delta wavelengths is what we get in deep sleep, which is our recovery from trauma. So when this vibratory force of the A.L.F goes up and it helps with that system and the movement and the motion of the frequencies, patients tend to just sleep better when they get it. Now, not every time, but when we get it right, they do. And I can tell you time after time after time, that's what my patients tell me, that they just sleep so much better when they get the A.L.F in. So it works in a lot of different ways, and maybe not the same way for every person,
right.
But the consistent result is an improvement in overall health.
That's so beautiful. That's amazing. And it's so small. So we've talked a lot about, I'm going to go over my most commonly asked questions that patients call and ask sometimes. How does it work? We've been talking all about how it works. Is general, but also as basically, I think, as we can. When you come in, some people, it's very individualized, and there's like 50 different, at least probably, designs of this type of appliance. Think of it as an umbrella that's called A.L.F, and then there's all these different kinds underneath the umbrella. And then some of them are in flux, where you might adjust them progressively. Let's say you're trying to also straighten teeth as one of your treatment objectives. Where maybe others don't need as much like adjusting. It's just feeling comfortable. Or maybe they're finished with treatment, but they still like to wear it. So that would be, but a question for a developing child or even an adult, how long do you often, if somebody asks you, how long do I have to wear this? Or how long is this going to take? Because I think sometimes people are comparing or trying to liken it apples to apples to this versus another type of therapy. How do you answer a question like that without overcommitting, and over-promising? You don't want to do that. You don't want to harm anyone. And you also want to set them up for what they might be able to expect, because that's a confused person is less likely to say yes and get to experience this.
Absolutely. And what I tell my patients is I completely understand why you would have that question, because we're trying to compare this treatment modality to other treatment modalities. That's what people do. They need to make an informed decision, and they need to have the choices made available to them. What I try to do is explain the difference between this approach and a traditional dental approach is that we want function on board first. And we want that swallow, and we want the breathing, we want the sleep. That is our primary objective. Getting the teeth straight, you can do that with just about anything else. That's the easy part of it. But getting function on board first gets a stable result, because when I tell my patients, I want to do this once and I want to do it right, because the tongue is nature's best orthodontist and best retainer. So we tend to get a lot more stable results because we get the face to grow and just not the teeth to move. And we get function on board and not just a pretty smile.
So you're addressing the cause.
Yes.
Some of the cause.
Absolutely. Well, that is our objective. Now, there are patients who will say, little Johnny has soccer practice, and I don't want to take him to the oral myologist and the chiropractor because, we have other things we need to do. And that's hard for me, because if you can imagine an analogy of sitting at a stoplight and you're the third car back, and the light turns green, but the two cars in front of you aren't moving, you're not going to be able to move. A lot of times the teeth are the third car back, and the first two cars might be the neck and the tongue.
Oh, that's
so
a good
they
analogy.
need to go to see these other therapists, because I'm not going to be able to do my job and get the face to grow without those other parts moving. This is about motion. This is about growth. This is about supporting the patient. So to answer your question about how long will treatment take, I'll say a lot of it is up to you as the patient to be able to do the complementary care that it takes to be able to grease the wheels, to be able to make this go faster.
Mm-hmm.
They need to be part of that green light. Regretfully, a lot of patients want an easy answer, so they will do an 18 to 24 month treatment plan of removing teeth and or hard rigid dental appliances.
Mm-hmm.
And that's fine. I say if that's the choice you want, if that's your objective, you just want straight teeth, then A.L.F therapy might not be the right answer for you. We're in it for the whole patient for the whole lifetime. And however long it takes to be able to get that done is what we're committed to do.
To me, I love your analogy, and here's one I like and I use a lot. It's sort of like if you have one of those bad grocery carts with the bad wheel. 3 wheels are working okay, and there's this one, though, that keeps making you list to one side, and you finally get so fed up, you might I'm going to go back to the beginning of the store, the front of the store, and get myself a new cart because I am tired of dealing with this chronic problem. It just isn't, I can't go straight. And I find that when we don't take those burdens off of the table and no one's talking about them, you're going to relapse just about every time.
Absolutely. And I honestly use that shopping cart analogy all the time when we're talking about the fascial system of the body. Because the fascial system of the body is like shrink wrap. It goes from your head to your toe. And when there's a restriction in your fascia, and regretfully, a lot of times it does come from the mouth and from the tongue,
Mm-hmm.
the whole body will compensate around that restriction. And when that happens, and you have, say, your neck, the first and second cervical vertebrae are turned to the left structurally. And if they're not being addressed by a chiropractor, physical therapist, or osteopath, the rest of the body will have to turn right to make that okay. Or if it's the eyes, if the eyes are not in focus and you think the middle of your head is down and to the left, your neck is going to go there to follow it. And then you're constantly going to be fighting that. So I tell people, listen, you're the shopping cart that wants to go left, and you have to put so much energy in it to make it go right that you're exhausted. So
I've written a book on sleep and connecting a lot of things you can do for sleep. And I did a herbal medicine program, and I did this integrative medicine fellowship. And as a dentist, this is talking about sleep through the dental lens. It's my version of different ways you can help yourself sleep. It's called Solve Your Sleep for Better Health. Currently, it's only available on Amazon Kindle, and I'm in the final editing stages of making it available they said to hold it up, to make it available for people in print, and hopefully by January, they're saying. So, there. Okay, thank you. Trying to follow along. There's definitely some typos in my current prototype, and but I'm working on it. So my first attempt at a book, and Dr. Angie Tenholder, she's in the St. Louis metropolitan area. If people want to reach out to you, Dr. Tenholder, I'm going to go ahead and give them which is your best email? If a prospective patient would like to find you, how do they find you?
The best email to get in touch with my business team to be able to get an appointment or ask questions is WeCare@WeAreSynergy.com.
WeCare@WeAreSynergy, SYNERGY.com.
Correct.
Very good. What's your office telephone number?
618-281-9729.
Very good. Can you say it one more time?
618-281-9729.
Thank you. Well, Dr. Tenholder also is one of the header-uppers. I call you the main head right now. You've really helped to organize the A.L.F providers in the United States. Dr. Nordstrom pioneered all of this technology. There are some other people that have come out after he started, and we're all trying to corral the dentists who do A.L.F in their practice and create more public awareness about the A.L.F and all the benefits of A.L.F. If people out there would like to know more or read about the A.L.F, you can go to www.alftherapy.com. And you can also, one of the things I really like is you are trying to show transparency of who is doing training actively, how long they've been doing things, because there's so many potential complications, and we don't want to hurt people. We really want to just help people heal fully, and it's a very personalized approach. So we were talking about myofunctional therapy, craniosacral therapy, What about those? What percentage of people that do A.L.F do you see that also do? I have a lot of answers for all this. Who also do myofunctional therapy, and should people out there? We don't offer individual medical or dental advice on this show, but if they're interested, should they find a myofunctional therapist first? What do you recommend for a consumer out there?
That's a really good question. I wish I had a really good answer. I can tell you that for the majority of my career, it's been a struggle because patients come to me and they're like, listen, you're here. I just want you to work with the teeth. And I say, well, actually, across the river, about 20-30 minutes away, there's an oral myologist that can help you with tongue function. And then you go another couple of miles, and then there's the osteopath. It's been difficult to be able to do that, but the patients who do get on board realize just how much better they feel faster. And now that I have enough of those patients to be able to call the other ones and say, just here's someone that I work with.
That's great.
But the other problem is not every dentist is going to have those resources. Like Dr. Nordstrom in California, he has an osteopath all over the place. We don't necessarily have that anywhere. So what we do with the A.L.F therapy community is we encourage teams to train together, to be able to have the dentist bring their physical therapist and bring their osteopath, bring the oral myologist. We have a course called Team A.L.F where we invite them to come together and teach them how to co-treat, to develop a common language to be able to support their patients. So I hope that's helpful. And it's not always easy, but it's always worth it.
Yes. It's amazing when you have all these different people that can use their expertise to unravel a cause that could potentially go back for many years, or it could have existed that patient's entire life. It's incredible how much quicker and how much more progress you can make in a short period of time. So other questions: is the A.L.F removable? And do they wear it all day or all the time?
One of the benefits about A.L.F over different appliances, especially for the pediatric population, is a lot of the early developmental called trainer appliances, Healthy Start, MyoBrace, a lot of them can address some of these early childhood developmental issues, but they are compliance based. And as a parent, I know it's hard enough to get my kids to brush their teeth and clean their room and do their homework, much less to wear oral appliances. So the A.L.F is a 24/7 appliance for the most part. Like I said, there's different versions, different, plugins that we can do. You can wear an A.L.F with the MyoBrace. You can wear an A.L.F with the nighttime trainer appliance if you have sleep apnea. But the goal is to be able to have an appliance that suits that patient's needs at that point in their life. So a lot of our parents say, when I give them the option, I can make this removable and you can take it out, or I can make it to where it's fixed, which means it's cemented in. And they're like, please cement it in. We don't want to have to worry about them taking it out and losing it or bending it, because the best thing about the A.L.F is that it's very petite and it's flexible. The worst thing about the A.L.F is it's very petite and it's flexible.
Right.
We get the benefit because of the flexibility and the vibration, but it can be damaged. So a lot of times we will cement it in for the younger patients. For the older patients, most people don't want to take it out, and they do completely fine. They don't even notice that it's there after a while. They notice when it's gone and they want it back, but they really don't notice that it's there. But there are many different versions and many different modifications that can be customized for what you want for that patient as a provider and what the patient wants for themselves.
Very good. Very good. So let's see if I have any other questions. We talked about it's being removable or not. How about, will my child still need orthodontic treatment after wearing an A.L.F?
And that
See,
depends.
That's the apples to apples question. And you're like not looking at apples to apples.
What I always tell my patients is the A.L.F is the tool to get the passengers on the bus. And the passengers in the bus, this analogy, are the teeth. And then the finishing work, which is going to be either straight wire orthodontics that is done a very specific way to be cranially friendly, because not every orthodontic system is cranially friendly, that can be used to put the passengers in their seats. So to be able to do that. Now, sometimes you don't even need that. Sometimes the A.L.F does a fantastic job of doing that. But there is something called A.L.F aligners, which is basically a clear aligner system that can be worn over the A.L.F, so you get the benefits of the wire plus the benefits of the aligner over the teeth that does the minor changes, and it's almost invisible.
That's great. That's really great. Well, I don't know what's not to like about the A.L.F. It can treat so many kinds of people and be done so many different ways. We have just a couple more minutes before we have to wind things up. Do you want to share anything else about the A.L.F. or insights, or how do you see maybe A.L.F. going forward? Could you share anything about or insights about how it might be done? Your website showcases practitioners literally from around the world. Do you see different influences in other countries about the A.L.F.?
Well, with the A.L.F. being around for 35 years and the word kind of getting out about the miracles that have been created with the A.L.F., it is one of those things that everyone talks about. But because we're trying to develop resources, it is not a mainstream therapy at this point, because if it were easy, everyone would be doing it.
Mm-hmm.
So what we're doing right now actively through our A.L.F. Interface Academy and our A.L.F. family is creating more resources for providers who want to get involved in this kind of training, this kind of service. Because when I first started, I had to really search for training. And what I'm trying to do is create for the other providers what I would have wanted for myself. And Dr. Nordstrom is the innovator of this, and he is passionate about making sure that the information is distributed accurately and effectively, and that we as providers function as a family to support each other so we can support our patients, because there's a lot to know about health. There's so many things that we don't know about how the human body interacts, and as a family of human beings, we're here to support each other. And so when you have providers from all over the world with all different experiences and all different levels of understanding, it's awesome to be able to come together. And we have forums, we talk as providers, we're here to support each other. And Dr. Nordstrom really is at the helm of this thing from an intellectual capacity.
Yes.
He is a genius. And he's the one who basically listened to the laws of nature and said, let me try to imitate what God did, because he had it right. All we need to do is honor him and respect the rules that he put down there for us. And as we humans live in an unnatural world, we're getting farther and farther away from what nature intended. So my goal as an A.L.F. therapist and as an educator and someone who's trying to advocate this to be a really, truly form of healing for patients going forward, not just a dental appliance, is to get people back to understanding this is about nature and function. And anything that we do should honor those. And if A.L.F. therapy is one of them, then we're happy to support that.
We are seeing increasing amounts of crooked teeth, for example, in our society. And there's a lot of lifestyle choices that genetically we really haven't caught up to where we are. For instance, sitting in school all day, we weren't doing that necessarily 100 years ago. And that might be something people might realize, well, wouldn't it be great if my kids could be outside more? But functionally with our teeth, we see a lot of changing going on orthodontically, and the A.L.F. is helping to replace and reinsert the natural world back into the mouth and have a manifestation that naturally just works better for our genetics.
Absolutely. And it feels better too. So when the patients are going through it, they know that it just feels organic to them. It doesn't feel like such an imposition on their life, because it is honoring principles. It's just something that works, and it works beautifully. So that's what we want for the world. We want to give as much of natural and nature's principles back, because there's so many other things that are taking it away.
Well, I really appreciate you coming on our show tonight. I think we're out of time, Dr. Angie Tenholder, but I very much appreciate you coming. And can you tell us your office number again for anyone out there who might want to personally reach you, please?
I'd also like to share the new website we have for the A.L.F. providers and patients.
Okay.
So it's a landing page for all A.L.F. resources, and it's ALFresources.com. And so it'll have links to the different websites. So if you're a provider and you want to learn more about the annual conference that we just had, there's a link for that. If you're a patient, you want to learn about A.L.F. therapy, there's a site for that. If you are a patient, you want to find a provider, and we have all of their education listed on that provider site and links to their individual office websites, A.L.F. directory, or ALF.directory, and all of those links are on that page. And then if you're a provider, you want hands-on educational courses, there's also a full site for that. So we want to be able to make it accessible for people so they feel like it's a real option for them.
Excellent.
So that's the information that I would want to share, even more than my own office number, which I will share again.
One more time.
I really want to support the A.L.F community.
Thank you.
My
Thank you.
office phone number is 618-281-9729. And that number can also be reached if you want to contact myself or Jamie, who is my administrative assistant for the A.L.F Interface Academy, to find out more about what we do with our organization.
Thank you so much, Dr. Angie Tenholder, all about the A.L.F, and I hope you have a good night. Thank you.